We're going to talk about chapter 21, which is IV solutions and equipment. There are a lot of things, a lot of slides in this chapter that I'm just going to pass over. I'm going to focus on the stuff that we need to know for the upcoming exam and the final. So IV solutions and equipment. So for IV therapy, that can be fluids, blood products, nutrients, any medications administered into a vein. They're very fast acting. This can include replacement fluids if the patient is vomiting, has diarrhea, or a hemorrhage, which is excessive bleeding. It can also be maintenance fluids to give them a normal level of fluid and electrolytes if they need it. Again, if you haven't realized in this class, the nurse is responsible for anything you give to the patient, whether that's IV fluids, meds, whatever. We are the ones that are responsible. So there's continuous IV infusions. This is to replace or maintain fluids and electrolytes. The flow is continuous until the order is changed by the physician or the provider. And then we have intermittent IV infusions. This is like a piggyback or a push, and this can be like pain medications, nausea medications, antibiotics, things like that, that we just give over a short period of time. It's not continuous. So there's lots of different types. There's bottles and bags. You're going to see bags most often. It really just depends on the manufacturer and the hospital or facility that you're at, things like that. Something to note here are these abbreviations. So NS is normal saline, D5W is dextrose 5% in water, RL or LR is lactated ringers. That's what you're going to see most often, is that LR, lactated ringers. And KCl is potassium chloride. So here we go. These are the abbreviations in your book. So NS is sodium chloride, and that 0.9% right there, that's part of the name. So I want you to make sure that you're not confusing that with any part of your math equation or anything like that. That's part of the name. Half NS is sodium chloride 0.45%. D5W is dextrose 5% in water, etc. So remember, if you're looking at these percentages here, that is all just part of the name of the medication or the fluid that we're giving. So here's a picture for LR, lactated ringers, along with D5, that 5% dextrose here. So we would call it D5LR. And then we have, so this says D5 half NS, that's actually incorrect. That 0.9% is full strength NS. So it's 5% dextrose and 0.9% sodium chloride would be D5NS. Okay, so then we have documentation of IV fluids. This chart, don't memorize it or anything like that. Just know that whatever facility you're working at, you're going to have an intake and output record that you document the fluids that you give, and then you'll also have a medication administration record where you'll document the medication and everything like that. If you have a medication that is in, say, 100 milliliters of fluid or something like that, you have to document in both places, so that way the fluid and the medication are both accounted for. So the orders, there has to be the name of the IV solution, the name of the medication to be added, if any, the amount or total volume to be administered, and the time period during which the IV is to infuse. Don't worry about the potassium. We're not going to worry about this stuff either. So let me just kind of fly through. Here we go. When you get further, if you decide to go into the nursing program, you'll see all of that stuff. So IV sites and lines, peripheral or central is where you're going to see an IV. A peripheral is going to be in the periphery. So like the hands, the forearm, the scalp. We actually do use a scalp for babies. Every once in a while you'll see it in the leg. Again, if you have a baby, then you might see it in the foot, things like that. And then the centrals are either subclavian, Broviac, Sean, Pick, whatever. That's going to be like a central line. The line itself is longer, and it is it sits closer to the heart. The primary line carries the main IV solution. This is going to be your continuous fluid or whatever. You can add things like potassium or vitamins that depend on your order. And then the secondary line is going to be that smaller volume, like your intermittent piggyback, things like that. So this kind of shows here your primary bag and your secondary bag. Primary is here, your secondary is here, and they kind of piggyback off of each other. Let's see, don't worry about that stuff. So we use pumps to deliver our medication. If you work in a facility that doesn't have pumps, then I'm going to teach you how to calculate med dosage for that. And it's also as a backup in case your pump isn't working, things like that. We also have patient-controlled analgesia, so that allows self-administration of pain medication. So we set that, it's a separate pump, we set it at a rate, just say they can receive, 2 milligrams every 20 minutes. So they could push that pump all they want, and all they're ever going to get is that 2 milligrams every 20 minutes. But it allows them to control it. So once it's available to them, they can push it and receive it right away, rather than having to call the nurse in to go get the medication, bring it back, scan it, all of that stuff. So it kind of gives them that immediate pain control if they need it. And we use that a lot, especially in surgery, things like that, where they do need more frequent pain medication. So these are different pumps that you might see. Again, it just really depends on where you work, what facility, what unit, things like that. So we're not going to worry about this stuff. So that is all that I have for you for chapter 21.